Hello everyone, I'm Dr. Ashley Damm and I'm a naturopathic doctor. I practice with the wonderful team at AccuBalance Wellness Center in Vancouver, BC. For World Wellness Weekend, I'm going to be giving an introduction to genetic testing. We're going to look at what genetic testing is and some of its clinical applications. We're now offering this test at AccuBalance, which is really exciting because it's a powerful new tool within our integrative healthcare model, and it really allows us to take integrative medicine to the next level. So genetics. It's common belief that our genetics or our DNA is our blueprint. What you have is what you're set with. People often think that their genetics determine their destiny and that there's not really much you can do about it. We do see examples of this to a certain degree, with our hair color, our eye color, and there are certain genetic diseases, absolutely. I remember back in university in my genetics lecture being asked, if you could have your genes analyzed, would you do it? And back then I remember thinking, well, wouldn't that determine your fate? If there's not really anything you can do about it to change that, I don't know if I want to know that information. As I learned more, it became apparent that in most cases, it's actually not that simple. There are genes that behave differently based on the environment that it's in. So in other words, your lifestyle habits, stressors, environmental exposures can all influence your gene expression. And this phenomenon is known as epigenetics. And this is really exciting because when we look at a genetic report, instead of it being this black and white, this is your destiny type of report, you can use that information and determine your specific risk factors and take a real proactive approach to optimize your health goals. It's individualized medicine at its core. This is an emerging field, and more research is coming out on specific genes and their association with different conditions. And this is really cool because it not only broadens our understanding of certain conditions and the potential risk factors for them, but it can also reveal new targeted treatment options for the individual. Now, before we get into the test itself, I want to review a little bit of terminology. So, as you know, our body is made up of trillions of cells. Cells in different regions of our body perform different tasks. Our liver cells are responsible for detoxification. Our eye cells support vision. Our intestinal cells are responsible for absorbing the food we eat, and so forth. The instructions on how to perform their specific tasks are encoded within our DNA. So we have 2 copies of DNA, one from our biological mom and dad, and every cell in our body carries the exact same form of DNA. So you can think of DNA as an operating manual containing all of the instructions on how your cell needs to do its job. A gene is a unit within our DNA, and it codes for the specific tools or equipments that your cell needs in order to do its job. We have approximately 22,000 genes, and in our analogy, you can think of a gene as a paragraph. It's a necessary component within the operating manual, but it depends on multiple and other paragraphs to really tell the full story. Finally, in order for our cells to perform their job well, they rely on multiple genes working together. So if we look at our liver cells as an example, its primary job is detoxification. So it needs one gene to recognize the toxin. It needs another gene to label that toxin as a toxin. It needs another gene to alter that toxin so it's no longer harmful, and it needs another gene to clear it out. So all of these genes need to be working together in order to adequately do their job. So in our analogy, this can be thought of as a chapter within the DNA manual. It's made up of multiple paragraphs with clear instructions for how our liver cell should do its job. So now that we've talked about some of the genetic terminology, let's get into the test itself. So all the patient needs to do from their end is a quick and easy cheek swab or saliva sample. Your sample is set in and we generate a report based on your genetics. Prior to sending the test in, we would do a comprehensive health history with the patient so that when we receive the report, we can identify areas that are pertinent to the patient's clinical picture. The report may also reveal areas that may not have been on our radar. In the report, once we receive it, we're going to be looking at the whole thing, lots of different areas, and the specific genes related to a specific area. So for example, if we're testing the efficiency of your detoxification pathways, we're going to look at multiple genes within that chapter that are all influencing your detox ability. If we then look at your cardiovascular health, we're going to look at all of the genes associated with your cardiovascular risk. And with hormones, we can look at the efficiency of how you're producing those hormones and if that may cause a predisposition to certain hormonal imbalances. And we look at many other areas, metabolism, mood, and so forth. Let's get into an example. So we have a case here. It's a 45-year-old male. He has a family history of cardiovascular disease, and he's interested in the genetic panel so he can take a proactive role to reduce any risks that he may have. When we receive his genetic report, it's a comprehensive report, and we would, of course, take a look at all of it. But for this example, I'm going to be focusing on 3 areas. So first, we're going to be looking at the genes associated with the integrity of his blood vessels. So how prone are they to inflammatory damage? We now know that cardiovascular disease is an inflammatory condition. It's not simply an issue with cholesterol, and specific genes may inform us of how likely his blood vessels are to becoming inflamed. So when the blood vessels come into contact with inflammation or toxins floating around in the blood, are they quick to become inflamed, or are they a little bit more robust and not so likely to become inflamed? That is something that we're going to take a little bit of a closer look at. The next set of genes we look at are his blood lipids. So is he prone to sending cholesterol to his blood vessels? We know that excess cholesterol in the blood that is sent directly to the blood vessels in combination with inflammation is a recipe for producing plaque, which is a known risk factor for cardiovascular disease. The last set of genes we look at are his detoxification pathways. How efficiently can he clear any inflammation or toxin that is present in his body? Is he able to clear it out quickly and efficiently, or is he a slow detoxifier? And so that over time, more and more inflammation is able to accumulate and can influence the level of inflammation at his blood vessels. So you can see how these 3 different areas really interact. We've simplified this a little bit to focus on 3 areas, but we can see that these 3 areas look quite different, all influence one another and play a role in the patient's cardiovascular risk. Often in cardiovascular disease, there is a lot of emphasis on your cholesterol levels, and they definitely play a role. However, if we look at this specific case, an example, if this patient's report showed that he had moderate risk of blood vessel inflammation, but he had optimal lipid profile, so he's not really sending cholesterol to his blood vessels. However, in the 3rd category, his detoxification pathways are really poor. Over time, he may not be able to keep up with the inflammation, and it may impact other areas and increase his risk. So if that were the case, we may want to target and optimize his detox pathways so that those genes are working better for him, because in his case, that might be the source of the imbalance and may be increasing his risk. Let's take a look at another example. So here we have a 28-year-old female. She's come in, she has a history of hormonal imbalance, specifically really heavy, painful menses. She's interested in the genetic test to develop a deeper understanding of what might be going on in her body. Now, there's a number of reasons one may have painful, heavy menses, and in her case, we may have ruled out all of those other causes. And in this example, we're going to be focusing on one common cause, which is an excess of estrogen. So let's take a look at how estrogen is metabolized and cleared out. It's accomplished by a number of different steps. So in the first phase, gene A comes along and it puts a tag on your estrogen and basically lets your liver know that it needs to be cleared out. Through that process, you're going to generate estrogen metabolites. There are 3 metabolites that can be made. So you can have the 2-hydroxyestrogen, the 4-hydroxyestrogen, or the 16-alpha-hydroxyestrogen. You can make a little bit of each, but depending on the genes that you have, you may make them equally or you may preferentially make one of the metabolites. This is important because these metabolites are still active and can have an impact on your body. 2-hydroxyestrogen is known to be more protective and anti-inflammatory compared to the 4 or 16-alpha-hydroxyestrogen, which are known to be more inflammatory. So knowing which ones you preferentially make can play a role in your clinical picture. In the next phase, we have another set of genes that come along and convert these metabolites into something that is harmless and ready to be eliminated. So functional genetic testing can provide information on the efficiency of these genes, whether some of these genes may be contributing to hormonal imbalances, and this information can allow us to target treatments quickly and appropriately. So if we come back to this patient, if we get her report and her genetic report reveals that she metabolizes the first phase really quickly, but her phase 2 genes are really slow, it means that she's likely going to have a buildup of these metabolites. So she's having a bit of a bottleneck effect over here. Remember that these estrogen metabolites are still active and can have consequences. Additionally, slow phase 2 genes can be associated with heavy menses because we're not clearing things out efficiently. So in this scenario, this ratio of a fast gene A and a slow phase 2 gene could be one of the causes of her symptoms. In this case, our approach may be to target the second phase so that the 2 phases are balanced out and she's effectively clearing out the estrogens. In this same patient, another scenario may be present, in which case both of her phase 1 and phase 2 genes are slow. This means that we're getting a bit of a bottleneck effect up here where she's not effectively metabolizing and clearing out the estrogen hormone itself. And in this case, we would target both phases to get clearance of estrogen working more optimally for her. So, as you can see, in both cases, there is an excess estrogen state, and they both could be contributing to her symptoms. The genetic test would reveal the most optimal way of clearing out that excess estrogen. We can then utilize specific nutrient therapies, supplementation, or lifestyle factors to influence how active these genes are to improve the efficiency of clearing out her estrogens. And this phenomenon of changing and adjusting genetic expression is known as epigenetics. So if we bring it all back to epigenetics, this term was coined by Conrad Waddington in 1942. In his studies, He demonstrated that environmental factors can interact with the genome and influence DNA expression, so how active or inactive your genes actually are. He studied this phenomenon in fruit flies. These changes can be heritable, but they are reversible. And so changes that you make in diet, lifestyle, supplementation, your environment can all influence your genes. And this is really exciting because with this information, you may be able to develop a deeper understanding of what's going on, have a deeper understanding of your specific risk factors based on your genes, and take proactive steps because you can make changes and influence how your genes are behaving. So that was a bit of an intro to genetic testing. If you're interested in learning more about genetic testing or more about what we do at AccuBalance, please give us a call. We have a really outstanding team at AccuBalance and would love to hear from you. Thank you so much for listening. Happy World Wellness Weekend.